Hi, I'm Nicole Alfred. Today I'm going to be talking to you and showing you some techniques about doing massage to your scar. So the first thing that you want to know is that you should not be doing this massage if you are less than 8 weeks postpartum, so post your C-section. You want to make sure that the tissue of your incision has been closed. There's no sign of openings, there's no sign of infection. And if you are starting this around 8 weeks, you definitely want to go very slow and very light. And anytime after 12 weeks postpartum, you're okay to go with a little bit more pressure. So those are the really important things I wanted to mention. Always consult with your doctor before starting any kind of new massage routine, especially with your scar. So getting the okay from your obstetrician when you're released from care is a good idea. So I drew what would look like a C-section scar on my hand here. As you can tell, they're never a straight line. Sometimes I call them a happy face because it's actually a bit of a smiley bottom there. Sometimes it goes up and kind of comes down. Sometimes the edges are a bit different. So no one scar is going to look the same. But what I want you to do is, if you have a belly flap, like a piece of skin, or your belly hangs over your scar, you're going to want to lift that up using one hand to lift it away from the scar so that you can use the other hand to do massage. Before we actually get started with a massage, what I want you to do is actually use your fingertips and actually palpate and feel the area around your scar, just so that you have a starting point. And the more massage you do to the area, you'll be able to over time feel the changes that are happening. So what I usually do is get people to take their fingertips and just kind of doing circles very, very lightly. I'm not putting any pressure. I'm just kind of feeling the skin going above, below, and on the actual scar, okay? Next, you're going to take your fingertips on the scar and you're just gonna move it up and down, side to side, like this, and do some diagonals. You just want to feel where the tissue is giving and where it's not, because areas where it's not moving very well, those are areas that you can actually focus your massage techniques to, because if the outside is restricted, there may be some restrictions happening inside that's leading to the issue. So we're gonna do some feeling. You're gonna feel around. You can even do kind of like fingertip presses like this, above, below, and on your scar. Sometimes you'll feel a bit of bumpiness. Sometimes you'll feel an emotional sensation come up when you feel your scar. So that's okay. Just work with whatever you can in the moment. If you need to take a break, do some breathing. If you are uncomfortable touching your scar, maybe you need to mentally prepare yourself before you do that. And when you're ready, with either an ointment, an oil, or a cream, you're going to do this massage routine. I want you to do the routine when you come out of the shower, when you put the baby to bed, whenever you have time in your day to incorporate a couple of minutes of massage is best. So don't make it like a big thing you have to do in your schedule. Just allow it to kind of flow and ebb through your day, and that way it will be more realistic for you to continue to do this routine. So the first technique is just like a finger pulling. So you're gonna put a bit of cream or oil and you're gonna just do some pulling below, on, and above. And you can go the opposite direction as well. Your pace, you don't want to be going fast, but you also don't need to go super, super slow unless you feel you need to. So you want to go a bit of a medium pace. And the pressure, again, at your comfort. You want to be able to feel like the tissue moving under your finger. You don't want to be tickling the area, so you don't want to go too light. And then you also don't want to start too deep either, okay? So we're just going to be doing finger tip pulls, both directions. The next technique I want you to do is called playing the piano. So you're going to use your 3 fingers here and you're going to place them along the scar and you're just going to press them all at different times. And you can also go below, and then you can also go above as well. You can move along the scar in either direction. You can also move above and below this way too. If you notice some redness happening around your scar, that is totally fine. It's just the blood flowing to the area. Stop if you do experience pain, and maybe just you need to modify your technique that you're using, go a little bit lighter. The next technique is fingertip circles. So you're going to use the one finger, and what you're going to do is you're going to draw big circles with your finger along your scar, below your scar, and above your scar. And you're just going to continue doing circles like that. Again, go at your own speed. If you're not comfortable doing a certain technique that I'm showing you, just leave it out and continue with the rest of them, okay? And the last one I'm going to show you is a little bit more of an advanced technique. So I want you doing this one after you've done the other three techniques. When you're comfortable and you feel like you can go with more of a deeper sensation or a deeper release of the area. This is a great one for releasing the fascia. So you're going to start in the middle of the incision. This one I would definitely recommend doing after 12 weeks. You're going to be pulling apart like this, up and down. You can pull apart side to side, and then you can pull apart the diagonals going one way and then diagonals going the other way. So remember, you may only be using one hand. If you don't have a belly flap hanging over, you can definitely use two hands to do massage, especially that last one. You can use one finger to kind of pin down the tissue and the other one to pull away. And you can play the piano with both fingers. You can do the fingertip circles, the finger strokes as well. But if you are having to hold your belly flap, you are only going to be using one hand, okay? So again, you can start without ointment and oil if you want more of a deeper release. If you can't handle as much pressure, then I would definitely go with using the oil or ointment to create more glide and slide for less pressure. I will see you in the next lesson.